If you're starting a clinical course, here are my 5 top tips for you. My name is Camille from Pareto Education and welcome to our YouTube channel. Today we'll be diving into 5 essential things you need to do to prepare as a clinical student. These essentials will not only set you up for success in your studies and placement, but also help you to enjoy the journey and make the most of being a student. So grab a pen or open your notes app and let's get into it. The first must-have is clinical equipment. We start with clinical equipment because it's absolutely fundamental. Things like a high-quality stethoscope, think a Littmann Classic or a cardiology, is a must-have. You're going to be using it almost daily for your cardiovascular and respiratory exams. And trust me, you want to hear those subtle murmurs or fine crackles. And this will help you when you're eventually going to do your OSCEs and also seeing real patients. So beyond this stethoscope, you probably will need a pen torch for assessing pupillary reflexes and a tendon hammer for those neuro examinations. Other less important things such as measuring tapes, tuning forks can be handy for musculoskeletal and neurological assessments, but these are typically provided by your placements or your university. These tools are directly relevant to you because they'll be important in your OSCE exams and you'll be marked on how confidently you use this equipment. Your senior colleagues will also be impressed with well-prepared students, so having a handy set of good equipment sets you apart. They also come in handy during placements because you will make a professional impression to your patients. Supervisors will notice your preparedness and it will boost your confidence. Also, don't forget a trusty little notebook or a digital note-taking device. It's invaluable for jotting down differential diagnoses, learning points from your seniors, or even those quick tips that can help you with your single best answer exams. Having everything in one place also means you can revisit as you revise, which is a great way to consolidate your knowledge. Secondly, textbooks. This one is all about textbooks and reference materials. Let's face it, exams and placements both demand a solid foundation of knowledge, and the right resources can make all the difference. We recommend textbooks such as Kumar and Clark's Clinical Medicine, which will be a foundation for your clinical learning and key content. The internet has a lot of OSCE resources, and we at Pareto Education have also got OSCE guides and even an OSCE AI bot to help consolidate your learning. We break down key components of key histories, red flags, and even material to support your clinical knowledge. Remember, clinical practice is essential, and books such as Kumar and Clark's or the Oxford Handbook of Clinical Medicine are packed with concise, high-yield information that will help you nail those best answer examinations and extended matching questions. So let's not forget digital resources such as apps like UpToDate, BMJ Best Practice, which can be lifesavers when you need to check evidence-based guidelines very quickly. A classic mistake that many students do make is buying too many resources at the start of the year. You want to streamline your studying experience and make things as efficient as possible. Try to stick to core resources and build on them if you need. Remember, your university will often offer free or subsidized access to these resources and availability of books at the library. So make sure you have your library card. Having reliable resources at your fingertips means you can look things up very quickly and is a real advantage when patient presents with something you've not really understood before. Number 3, digital tools. Moving on to digital tools, there's a lot more than just having a smartphone. Apps such as MD Calc can help you with this clinical decision making. YouTube is a great resource for OSCE videos, and NICE guidelines for treatment pathways are very good. And if you're serious about organization, digital note-taking apps such as Notion or OneNote can help bring structure to the massive amounts of information you'll cover. Remember, you can create your own flashcards using applications like Anki, linking your lecture notes to your clinical cases and track your progress over time. On the topic of OSCE videos, do check out our YouTube channel for other videos. We have a massive suppository of fantastic OSCE videos as well as topic explainers to help you pass your exams. Here's another top tip. Many universities actually subsidize purchases of essential digital products and equipment, so do check out what's available to you. Some courses also offer discounted or even free software like Microsoft Office or specific clinical applications that would otherwise be expensive, and don't miss out. Lastly, when you're setting up your digital toolkit, this is the perfect time to get strategic. Have a look through your curriculum or course handbook and identify key things that you'll be assessed. Whether you're facing knowledge-based examinations or a big OSCE component, reaching out to current or former students, and finding a mentor can be really helpful. These can help give you insights on which topics come up repeatedly, how to approach your revision, and how even to prepare your placements. Having this clarity early on will save you so much time and stress later. Here's tip 4 about clinical clothing. You need to look after yourself and start with your budget and think about your clinical clothing. You'll be on your feet for many hours during long placements, so you need to be comfortable as well as professional. Smart shirts, comfortable scrubs, and supportive footwear will make a world of difference. You have a lot of scrub company choices nowadays, so you can think about what's most suitable for yourself. Remember, it is suitable to wear trainers with scrubs. Conversely, if you have a specific uniform, make sure you get that organized early and make sure it's looking smart and clean. Some places or organizations are notorious for not giving enough scrubs or tunics, so make sure you have enough to get you through your clinical placements. You may be doing back-to-back shifts, and the last thing you want to do is do a double wear on a hot day. A fob watch or a clip-on watch is also worth investing in. Remember, a lot of trusts have a rule about bare below the elbow, which is to do with preventing infection. It's also quite unprofessional to take your phone out for the purpose of timing, so thinking about a watch is quite useful. Clinical placements and extra equipment can get expensive, so budgeting is crucial. Check out whether your university or NHS offers bursaries, hardship funds, as many do for clinical students. If you're relying on student loans, make sure you understand how much you're entitled to and plan accordingly. If you're considering part-time work, be realistic about how much you can do alongside your studies. Some people prefer to work alongside holidays to avoid clashing with placements and exams. Whatever you choose, create a schedule that prioritizes your studies. Clinical courses are intense, but you don't want to burn out with juggling too much. And the last tip I've got for you today is having a prepared mindset. Finally, let's talk about this, because this is what will carry you through those tough days. Clinical placements can be emotionally and physically demanding, and exams are intense. One of the best things you can do for yourself is to create a system for reflection and winding down. A reflective journal can help you process what you've learned, identify gaps, and celebrate your progress. However, often alone isn't enough. You need to be assessed as part of your clinical practice, so don't just treat this as a box-ticking exercise. If you have performed an examination or a history and require feedback, have your forms ready to get immediate feedback. From experience, sending an email 7 days down the line to a senior colleague could be ignored. Remember, it's normal to feel overwhelmed at times, and no one expects you to know everything from day one. So be open to feedback, ask your questions, and treat every patient interaction as a chance to learn. And that's what clinical learning is all about. I suppose the last tip, bonus tip, is to enjoy this university experience. University isn't just about exams and placements, it's about connecting with peers, building networks that will last your whole career, and making memories that will go far beyond the lecture hall. Go to events, join societies, and embrace the chance to be part of a dynamic, supportive community. These friendships and networks can be a huge source of support, especially during exam season. So there we have it, 5+1 extra tip to help you with your clinical course. These practical tips will help you make the most of it. Throughout each academic year, Pareto Education supports students countrywide with regular webinars, courses, and content such as this video. So be sure to like, subscribe, and keep in touch, and best of luck with your studies.